Welcome. I'm Dr. Jesse Morse, a sports medicine physician in Miami here at the Osteopathic Center. We treat all different types of orthopedic injuries on the orthopedic part of our practice, and then we have the integrative side as well. But today I wanted to talk about a very common issue, a very unfortunate injury that once you get it, usually loves to rear its ugly head again. So the fact that most of us are probably going to deal with this in some capacity in our life is unfortunate, and that's back pain. So, back pain comes in all different varieties, all different descriptions, all different causes. But in general, there are some generalizations that we can make. There are some treatments that some people aren't aware of that are available, maybe not everywhere, but kind of the primary purpose of this is to really give you an idea of letting you know what the injury likely is, what the core issues are with it, and what are the treatment options, whether they're available to you or not. And the more information you have, the better you can approach this. As a side note, yes, we are in Miami. We also have a small satellite office in Jupiter, a couple hours north of here, and another office in Tennessee in the Knoxville area. So if you are close, you can obviously get evaluated by us. But if you're on the other side of the country or the other side of the world, which a lot of the times happens, we can do video conference, in terms of appointments or something like that. So at least walk you through without having to fly across the world and give you an idea, even if it's a phone consult, to say, this is my issues, this is what I want to see if this is something that you can treat. Thankfully, medicine is pretty universal when it comes to that, as long as it's in the same language and the imaging studies were appropriate. In general, back pain is very debilitating. There's a reason why it's the most common cause of disability here in America. That's probably applicable for a lot of the world. There are several issues with the low back, and every time you stand up, every time you get out of bed, you sit, stand, get off the toilet, like anything, you need your low back, unfortunately. So this is an integral part of our life. Now, the low back and the neck are very similar. I will do a separate video for the neck because that's its own special headache. But think of the neck as a smaller physical version of the low back, but most people have low back issues. Some people, unfortunately, are also blessed with cervical issues as well. But I'm going to really focus on the lumbar aspect, and I'll use my buddy here to help kind of demonstrate. So the majority of issues in the low back are lumbar. Very rare do we see a true thoracic injury. It can happen, but just not super common. Rarely, like probably 5%, something like that. I don't know exactly what the data is, but just based on experience, that's usually what we see. It's just not common. And if you were to ask what is the most common location within the lumbar spine for issues, I would say L4 and L5 almost 95% of the time. Common things are common, and that's where we have it. L5, S1, which is where it meets the sacrum, that's the most common area, probably around 70%. That's just ridiculously high. And unfortunately, that's where we have our issues. So you can see the camera's just kind of reaching at L4. I'm going to tilt it a little bit so you can appreciate it. So as we talk about it, here's how the back is structured. And I have another model over here that's a little bit better visual. What's going on traditionally and how are we built? So I'm going to step back to the anatomy so that you understand how we're built, so that when you understand the injury, it makes sense if you understand how it's built. So the way we are built is we have discs that essentially sit in between each of the bones. The purpose of the disc is to, in my opinion, do two things. One, prevent those two bones from smashing. But the other issue is it also helps to provide cushion in between each of the bones so that the nerve has space to come out. The spinal cord is in between this. So it's running north to south in here. And what happens is at each level, it's essentially like a fork in the road. So each level, it can go left and it goes right, every single level. So if you have an injury that's only squeezing on the, we'll call it L4, on the right side after the split, then you're only going to have symptoms on that left side traditionally. If it's only on the left side, then you ideally only have them on the left side. But if it's in the middle or both sides, then you can have either or both. So knowing where the injury is and where the symptoms are can help oftentimes differentiate what's going on here. The other thing that I like to, especially when I'm working with any students or anything like that, I like to tell them is that the patient often knows what's wrong with them. They just don't know how to describe it. So your goal is to kind of ask the right questions, tease out the right information, and they usually have all the information or most of it. You just need to put it together like a puzzle. And in most of the times, you can figure out a very, very large amount of information really without even touching the patient most of the time. Obviously, there are certain things that you'll need to do, tests, sometimes imaging, in order to really solidify it. But knowing the symptoms, if you know the anatomy, if you know the medicine, you can get a very good idea what's going on before even physically evaluating someone and saying, what that is concerning, no, that's pretty common, or something like that. So oftentimes what happens here is there is a lot of ligaments that run the show in this area. Think of a ligament as a bolt for a car engine. That's kind of the best way I can think of it. That car engine is very dependent on those bolts. If not, there's way too much movement if those bolts are loose. Well, that's what happens with our ligaments in our body, in particular our spine, because we're using them every single day, thousands of times a day. With every movement, mostly everything is stabilizing. Or if it's not stable, then it's trying to hold on. Think of a ligament as the ligament itself as almost like an elastic band. When you have an elastic band, it's supposed to be, say, this tight. But what happens if you stretch it out here and then it comes back here? It always has a little bit more play because it's very hard to get back to that original tightness. That's what happens to ligaments. So once they've been stretched, they lose that elasticity to be able to get back here. So if the body needs it to only be able to move this much, but the ligament was stretched, now it's doing this. And then the other side, because we're pretty symmetrical, if that happens on one side, well, now the other side is either going to be longer or shorter depending on what the first side is doing. So there's a lot of imbalance, and this essentially is instability. That's, at the end of the day, that's what it comes down to. There are a lot of muscles in here, a lot of important muscles that run up and down the spine, in particular called the multifidi, which are notorious for becoming weaker. The core muscles are equally as important. Core, think of low back, but most people fail to appreciate the front. So if this is a balancing board, you can't just strengthen one side. You're going to topple over. You have to balance out both sides. When you balance out both sides, the center is stable. That's what people need to be able to appreciate. You have to be able to stabilize the back just as much as the front. That's when they say core is king, core is important. And there's a lot of parts to core. You know, you have the hips, you have the low back, you have some of the flexors in the front, you have some of the core abdominal muscles, you have some of the groin muscles. All of these play a role in stabilizing your core. And in doing that, there's a bunch of different ways to do it. But in general, that can help eliminate a lot of low back pain. One of the most common issues in the low back is when a disc is not super happy. So think of a disc, and I have another model right here that's pretty helpful. So this is what a disc should look like. See the spinal cord? This is the back of the spine, this is the front. Now think of this as a jelly donut, okay? What happens when you squeeze a jelly donut? Whatever the weakest part is, that's where the jelly is going to squirt out of. Like that. Okay? So here's the problem. The front of the spine is very strong. So we traditionally don't think of this. This doesn't concern us really in the front because there's a huge, thick ligament in the front that has a tendency to keep this strong. But here's the problem. You're running out of space. This is bone and it's not moving. This area has a lot of additional ligaments that aren't on the model. So we're already starting to compress stuff. I want you to appreciate something. I'm going to rotate this. Look at the size of this nerve. Okay? It should have plenty of play. A little bit less than the model shows, but in general, you get the idea. What happens when that nerve is being pinched? Look at how big it is. Again, look at the size. Look how big this bad boy is. That's a pinched nerve. That's exactly what it is. So if it's supposed to be kind of like this with plenty of room, even if it's only millimeters, and now you're squeezing it, that nerve runs the show. That's the battery for your car. Without that, you're not starting it. If that nerve's being pinched, you're going to have sharp stabbing, throbbing aching. You can have numbness and tingling. You can have weakness. You can have muscle spasms. And a lot of you are probably thinking, yes, that's me. It's because the core issue is that the nerve is getting compressed. Now, oftentimes, this may be positional. So you might be like, in certain movements, I feel better. And that oftentimes is because it's getting a little bit of space. And it's just getting a little bit of a break. So it goes from being super squeezed and you move and it just gets a little relaxation. And sometimes that's all it takes. But the core issue is that this whole area is unstable and it can't handle the stress you're asking. So if the ligaments are weak, then when you do something repetitively, you're weakening the ligaments and ideally and realistically the muscles, and that in turn translates energy around the area. So what happens? Eventually you get to a tipping point, almost like a straw that breaks the camel's back, and you start to push the jelly of the disc out. Here's the problem. It should be like that if it just stays in the donut, in the disc. Now each level we have this. But what happens if it starts to squirt out like that? Now we start pushing on nerves. When that happens, it's a space issue, 100% space issue. There is no space to go. So if you think of traditional medicine, and I use that term politically, what do? They give you oral meds, either anti-inflammatories, your ibuprofens, your Aleve, your meloxicams, the stronger versions, to decrease the inflammation. But in low back, that's usually not enough. If it's mild, maybe it helps. So, okay, you use a Medrol dose pack, a very potent anti-inflammatory. After you gain weight, after your blood sugar skyrocket, after you're very moody for 4 or 5 days because of the med, you feel much better. We won't talk about the side effects. Those are unfortunately part of the issue. But what happened? You decreased the size of the nerve indirectly. But you didn't fix anything, right? We just band-aided it. We got it to calm down, but we kicked the can down the road. It's technically smaller, but is that area any more stable? No. You didn't do anything. That's where therapy comes in, and sometimes that's where stability comes in injections and stuff like that. So you say, all right, I've heard of an epidural injection. What is that? There's a couple different ways to approach this. The most common one, not the one when you're delivering a baby, that's a little different, is to inject either at the facet joint, which is this joint right here, or up the canal, depending on how low it is, and it will basically infiltrate the space and to decrease the area from a direct approach, an injection approach, as opposed to an oral and hope it gets to the area. Much more specific, but again, what are we doing? We're just decreasing the size temporarily. If the jelly is squeezed out, it's still squeezed out. That's not going anywhere. The body will remove some of it if it can, but it doesn't replace it. It doesn't have that luxury. So what happens? You are temporarily buying time. And once that pain comes back, which usually it does, it may be 2 months, it may be 5 years, then you need another epidural because you are essentially only blocking the nerve and telling your brain, hey, you're not in pain. But in actuality, you're still in pain. Your brain just doesn't know it because the medicine is basically blocking the signal. But here's the problem. If your body finally catches up to the cortisone and says, you're not going to work on me anymore. I know how to get rid of you, and this pain is just too unbearable. What happens after that? Well, most people really have, for traditional medicine, we'll say they have one option. Surgery. Or live with it, I guess, is a possibility. Or narcotics, which is the worst of the three. Then they're like, what are we doing? So a lot of the times, they'll put a bridge in here. They'll put a metal bridge, but basically they put a screw in here, or multiple screws, here, and literally forcibly keep this open with screws. What's the problem with that? It works great. Very effective. It's a surgery, and you're going to have a lot of scar tissue as a result. But that's okay. If you want immediate relief, that's the answer. When it's severe, when you've been dealing with it for a while, and you failed all the other stuff. But what happens? So if you do it at this level, that stabilizes, we'll say, these two. Well, all the energy now goes to the one above and the one below. So guess what you need in 5 years? Another fusion. Because now the disc below and the disc above, depending on where it is in the spine, usually are taking a beating. And they end up getting just as damaged as the previous one. Until you basically either are miserable, have most of your lower back fused, or you're dead and you don't have to worry about it anymore. That's the issue with some of this issue, some of the traditional care. Now, if you're lucky and you don't have to deal with this, well, thank you for watching, first off. And the other part would be, you likely know someone that is dealing with some type of low back pain. There are a lot of different varieties of it. And at the end of the day, it usually comes down to a nerve being pinched or some instability that you're feeling either directly or indirectly. There's something else I want to address very briefly, and then I'm going to talk to you about one more thing. See the two different sides of the model? This is traditional without any muscle attachments. This one shows you the muscle attachments. These are the glutes, okay? The glutes are your buttocks. That's the maximus. That's the one on the outside, right underneath the skin. As you start to get closer to the bone, they go medius, which is usually the culprit, and minimus. If someone has low back pain, I want you to ask them to push just underneath, so not in the low back, but the back part of the hip. This is almost always tender. This is the glute med. And you can also assess the tailbone. This is part of the issue. This is usually the injury site. But this is the issue. You have to address both areas. That's the problem. You have to address this area, or it's not going to get better. This is your SI joint, if you're asking. This is your SI joint, sacroiliac. So you can see it right there. The other thing I want to talk about briefly, because I have the thing here, and it has to be angled down. The tailbone. The tailbone, the sacrum, has nerves coming out, just like up here. But what we fail to appreciate is that there's ligaments that hold this in place. Okay? So this is supposed to be flush. What happens when these ligaments, one of the two sides or both, get weak? This starts to rotate. But remember, those nerves aren't really moving. They're in a very specific path. So if this is supposed to be here and the nerves are coming out and they're going down, and this is rotated, now you're pinching the nerves on this side, and this side says, I have plenty of space. And that's because the tailbone is out of place. And oftentimes, when Dr. Carter, because he's a DO, evaluates these, he can feel that the tailbone is shifted. He literally would be like, it should be lined up like this, and it'll be like this. Or, that's dramatic, and that is part of the issue. You can put that in place physically. It's not comfortable, but you can do it. And it's very, very helpful. The problem is, if you don't strengthen those ligaments, which is very hard to do, it's going to just fall right back out of place. It's like you didn't do anything to keep me in place. And the thing that's keeping me in place, the ligaments, are weak. They have way too much movement, and everything is shifting. Strengthen the issue. The ligaments. That's the issue. That's where regenerative medicine has come in. You put steroid into that ligament, it's not going to do anything. It might even make it weaker. You put some type of injection that is going to strengthen that tissue and increase the strength and build new tissue. Now we're talking. Now we can re-strengthen that area, and now we can make progress. But don't stop there, because what happens over time? Our body corrects itself so that it's not in as much pain. Well, and the way I think of it is this. We're supposed to be driving in this lane, but our body is trying to compensate for pain, and it decides to jump in between two lanes. So it feels better. But after you do the injection, you're still in between two lanes, because the body doesn't know any better to go back into the lane it belonged. That's where physical therapy comes in. You have to correct the imbalances, the compensation patterns that have developed as a result of the injury. Once you've corrected those, everything should work as needed, as planned. Here's the other problem. This requires maintenance, like a car. You can't expect to change the tires once and then never change them ever again. That's just not realistic. Sometimes this requires keeping the core strong, as it should, keeping weight under control so you're not pulling the spine backwards or forwards. Think, if you are 20 pounds overweight, what has to work harder to keep you upright? Makes sense, right? It's just simple physics. That's the problem. People don't think of some of the simplest basic things. If we have excessive abdominal fat here, this low back is constantly under stress because it's literally pulling you forward, and this thing has to work harder to keep you upright, unless you want to walk like that. So sometimes even losing a little bit of weight goes a long way for knee pain and for back pain. Every pound of abdominal fat, additional weight on the abdomen over what you're supposed to be, is 4 pounds on the knee. I don't know if there's a correct connection specifically number-wise for the back, but there's definitely one for the knee. Simple things can make a big difference. Flexibility, getting the alignment, getting things proper. So the other thing I want to comment on while we're here, see how the hips are supposed to be lined up, okay? That doesn't always stay like that. If someone's ever tell you, I feel like my hips are out of place, or one leg's longer than the other, well, that's because one of these is higher than the other. This ligament in the hip can't hold this in place. So what does it do? It sags. So now everything else is going to compensate because the body can't hold that in place. So instead of being like this with our hips, we're like this. So now everything's off. It's like the alignment in your car, and half the car is an inch higher than the other. Everything's going to feel off. That's basically what happens. The ligaments can't hold the hip in place, or the tailbone, like we talked about a little bit ago, the sacrum, and everything has to compensate. And if it's not strong enough to fix itself, which usually it isn't, that's why you're dealing with it, then that's just what happens. That's how you feel, and that's how you live. Therapy is very important for this, very helpful. But sometimes it's not enough. And that's kind of where this comes in. You shouldn't be eating anti-inflammatories like candy. They're not good for you. They cause blood pressure issues. They cause kidney issues. Depending on which ones you're taking, they can cause liver issues. There's way too many snowball effects, and they're stressing other organs and other body parts just so that you're able to function. Fix the issue. There's probably a lot of questions you have, and a lot of them are generalized. A lot of low back issues have to do with the hip. A lot of the times when someone comes in for low back pain, we evaluate the hip and we say one of these hips, or sometimes both of them, are injured. So oftentimes we even get imaging of the hip and we can see a compensation because you just feel pain. Differentiating where that pain is coming from is very difficult. That's where a skilled practitioner can help. And oftentimes we'll even do a local lidocaine block. So say we suspect that we have pain at the low back and at one of the hips. So what will we do? We will literally go in and inject the areas of instability that we think are causing the pain. Say it's in the posterior part of the left hip / back. We'll numb up those areas. What does that do? That tells the brain, hey, you're not in pain anymore. It's temporary, but it's for a purpose. Now we say, you came in with 100% pain. Where's your pain now? Is it all gone? No, only half of it. Well, then your low back is only half your problem. Now we need to figure out where the rest of the problem is. What else is contributing to your mental pain? And then you figure it out. So a lot of people will be like, oh, I thought it was my back the whole time. It might be, but there may be other factors contributing. You have to figure out the source of the pain in order to properly treat it. We don't do a shotgun approach and just hope that things get fixed. That doesn't work. You just end up dealing with this stuff long term. Figure out the issue, correct it, and then maintain it. If you take anything, that's what I want you to take out of this. I hope this was helpful. There's a lot of things in back. I could be here for 3 hours. I don't need to be. But I feel like this could be helpful for you to understand some of the things that we see and to help you understand exactly what's going on as a result of your pain and ideally which ways to treat it. We have a lot of different ways to treat this. We can start with a very mild medicine that basically stimulates healing, but a very mild version of it, what we call prolotherapy. They used to have super potent stuff. We're not available anymore. Now, the most common one we use is dextrose with a little bit of lidocaine. Basically sugar, in so many words. Very local injection, very specific. The next step up is PRP, platelet-rich plasma, the one we take out of the blood. Inflammatory might be an understatement, but it's natural, it's coming from you, and pretty effective. I want something stronger or the injury is just that bad. Let's do 3 times the potency of PRP. That's bone marrow or adipose. Both of those are sources of stem cells, of medicinal signaling cells, from your body, going back into your body. We're just concentrating them and putting them where they need it. Then you have some of the higher level products that are allograft. They're not from you. Amniotic tissue exists. Wharton's jelly exists. Something called exosomes exist. And this isn't the platform to discuss those, but they exist and they're really potent. Whether or not your local doc, your local city has it is a separate discussion. And they're not all created equal. But they exist and they work beautifully. If you want to know more, you know where to call. If you have any questions, message us, call us, email us, say, hey, I've been dealing with this for 5 years. I'm sick of it. What can we do about it? Nowadays, we're just playing right away. If we need to treat it, we need to fix it. Or at least we can give you guidance. We can give you reassurance. Don't let this take over your life. It doesn't have to. Back pain is debilitating. But there's always something that can be done. You might not know what it is, and you might not have the resources near you to do it. But that doesn't mean it can't be done. And if you're willing to finally say, I'm done being in pain. I'm reaching out here. Let us help you. Thank you for your time. We'll see you soon. Take care.